Coming up, focus on health from the Denver Post with Deanne McKetty.
Over 20 million American men suffer from impotence, but do you realize that virtually every man can be helped? Please welcome Dr. Fred Grossman, a board-certified urologist and director of the Male Care Center here in Denver and Littleton. Dr. Grossman, welcome. Please explain, what is impotence?
Impotence is defined as the persistent inability to achieve or keep an erection which is suitable for sexual intercourse.
Interestingly enough, 25% of all men suffer from impotence by the age of 65. Explain what causes impotence.
Impotence is caused by, most commonly, an inability for enough blood to enter the penis to produce an erection, or that the blood would leave the penis too rapidly, a so-called venous leak. The most common cause of this is either hardening of the arteries or the associated high blood pressure. We also have causes related to hormone inadequacies, such as low serum testosterone or perhaps diabetes. Diabetes seems to produce poor blood flow and maybe nerve damage to the penis. Interestingly, the incidence of impotence in diabetics is about triple that in the population, almost 60% at age 65. Pelvic surgery, either on the prostate most commonly, but also blood vessels or lower intestine, can interfere with the nerve supply or the blood supply of the penis and thus produce an impotent patient. Finally, the side effects of medications, such as medicines used for high blood pressure or those used for depression, may cause impotence. We should not forget that some patients are psychologically impotent, even though we now have put a bigger emphasis on physical causes.
If treatment for impotence is desired, physicians usually first prescribe Viagra, Cialis, or Levitra. This traditional oral therapy works for 60 to 70% of men. Dr. Grossman will now discuss other treatments, which are available when conventional oral therapies are either ineffective, too costly, or produce unpleasant side effects.
We are using testosterone therapy for replacement of those who demonstrate deficiencies and who can take it safely. We are still using penile injection therapy for patients who do not respond to conventional oral therapy or other treatments. And most notably, what makes a urologist different, in my opinion, is the ability to implant an inflatable penile prosthesis. I think we have a video which shows this magnificent device and a patient who has actually had one implanted here today.
3.5 years ago, I had my prostate removed, and it left me impotent. The urologist introduced me to several methods of overcoming impotency, but none were satisfactory until I tried the implant. And that was marvelous. And it was covered by insurance. And I've had it now for 3.5 years, and it's never failed to work. I play tennis, I'm a carpenter, I just do whatever I want. I'm never aware of the implant, except when you want it. And it's just marvelous.
Dr. Grossman, explain, why is it important to go to a urologist for treatment?
Urologists have been specially trained in the management of diseases and the anatomy of this part of the male body. The complications of various forms of therapy for impotence are rather unique and, in my opinion, are best handled by a urologist. Finally, the testing, the diagnostic measures we use are quite unique and require special training. Most notably, these include the measurements of penile blood flow, as well as the presence or absence of erections during sleep.